So we've got Dr. Christina Pastan here today. As an endodontist with over 2 decades of experience, Dr. Pastan knows the stresses that can come with practicing dentistry. She's also a longtime practitioner of yoga and meditation, and as the first director of Mind Body Wellness at Tufts University School of Dental Medicine, she helps incorporate mindfulness into the training of the next generation of dentists. The curriculum focuses on lowering stress to improve students' overall well-being, which in turn will decrease burnout and increase resilience. She hopes to impart the same skills to veteran dental practitioners. So join me in welcoming Dr. Pastan.
Thank you. Thank you so much for having me here today. Karishma, Michelle, District 2. So I thought I'd just start by telling you a little bit about myself. I am a 91 graduate of Tufts Dental School and a 94 graduate of the PG Endodontic program. I'm a practicing endodontist in Back Bay, Boston. And I never stopped teaching when I left dental school. I always wanted to continue to volunteer a morning of my week to come into the school, to give back to the school that gave me the opportunity to become a dentist. My dad was the dentist, went to SUNY Buffalo. So when Karishma brought me into District 2, I feel that my dad wanted me to go to SUNY Buffalo, but I wanted to stay in Boston. So I feel this is my way of giving back to his community. So I've always taught in the PG Endodontic Clinic. And you might be wondering, what is a director of mind body wellness and why would a dental school need one? Well, it was an experience that I had teaching in the PG Endodontic Clinic that catapulted me into a very different type of teaching and a type of teaching that I never ever imagined myself doing. So here's a story that I want to share. So one of my PG residents, a second-year resident, asked me if I would mentor her in her first apicoectomy. And so the following week, when I showed up in her operatory, she appeared to be a very different woman than I had previously worked with the year before. When I walked into her operatory that moment, she was speaking fast, she was moving fast, she was setting up her operatory like a tornado. She started to articulate that she was very nervous about the procedure, that it was tooth number 12. The root tips were in the sinus. What if she perforated the sinus? What if she couldn't stop the bleeding? Instruments were flying on the floor. And I knew in that moment that I could relate to her because I once was a second year resident doing my first apicoectomy. But being a longtime practitioner of yoga and meditation, I have evolved to be a very different woman, a very different endodontist. And so I knew the first thing I needed to do as her instructor was to make her aware that she was not in the right frame of mind and body to do a surgery on a patient. So this is before I got trained in yoga. So I asked her if she wouldn't mind trying a breathing technique. I didn't know what else to do. So I decided to step out of my box and do something very different. Pulled in a chair, sat her down and had her put one hand on her heart, one hand on her belly, and began to teach her this 3-part yogic breath. So within moments, I watched her whole body relax, her breathing slowed down. She became more focused. And she looked at me and she said, "Dr. Pastan, I think I can do this now." And I said, "You think you can do this now?" I said, "I knew you could do this surgery when I was driving down to town today." I said, "What you're realizing is that you're in the right place to perform this surgery. So go get another cassette and let's get going." She does the surgery. I tell her how to use the breath through the surgery, that when things get hairy, how to stay composed. She does a great job of the surgery. I wasn't surprised. She was one of our top residents. And as I was gathering my belongings to head to my practice, I commended her on the surgery and she said, "Dr. Pastan, you changed my life today." And I said to her, "I changed your life? Now, how did I do that?" And she said, "Well, I've been struggling with anxiety my whole life. And I said, I've always found ways to compensate for it. And you are the first dental educator that noticed my anxiety. You called me out on it and you gave me a tool to cope. She said, you may have just taught me the most important skill I've ever learned in dental school or maybe in my life. Well, that's all Christina Pastan had to hear on her way to the garage to say, I think I have a new calling in my teaching. So my children went off to boarding school and I went off to yoga school. I went out to the Berkshires of Massachusetts to the Kripalu School for Yoga and Health, and I became certified in yoga and meditation. I'm a 300-hour yoga and meditation teacher. Everyone that knew me thought I was having a midlife crisis. Why are you, a practicing endodontist, going to yoga school? And I said, I have a vision and I have a new calling. Came back and approached our administration. And I said, if we have students in their 7th year of education that don't know how to manage their anxiety, and we had a student that was going to attempt to do a root canal, an apicoectomy on a patient in a very nervous state, we need to teach all of our students how to manage their stress. So I am going to share my screen and start with the rest, move on with the rest of my presentation. Okay, so just let me know. I'm just going to open this up a little bit. Hold on. Okay, could you all see my slide? All good? Okay. So Tufts may be the first dental school to incorporate mind-body practices in the curriculum, but the notion of dentists being of sound mind and body is not new. When we go back to the first code of ethics written in 1866, one of the first major points in this original document says the following: that the dentist should be temperate in all things, keeping mind and body in the best possible health, so that his or her patients may have the benefit of that clearness of judgment and skill, which is their right. Now, I don't know if the person back in 1866 who wrote this was thinking about yoga and meditation and breathing practices, but the standard in their code was supporting our responsibility as dentists to be of sound mind and sound body, not just for ourselves, but for our patients. And that is not what my resident that day had any embodiment of. So I'm sure you all have been through your professionalism and ethics class and have read this handbook. And so on page 4, it says, striving to become a professional means to develop yourself as a dentist with exceptional technical skills, exceptional communication skills, and to develop and grow as a human being, cultivating the qualities you need to be grounded in yourself. So basically, on receiving your degree in dentistry, you become a participant in the profession, in that we can't assume that a participant is necessarily a professional. And so we need to strive to become a professional in the truest sense of that term. So as I said before, striving to become a professional means that we need to have exceptional technical skills, exceptional communication skills, and we need to blend that combination of skill and development in a way that makes us well-rounded. We need to be moral, we need to be ethical, right? So there's a lot that goes into it, right? When we get our DMD, it doesn't necessarily just make us a professional. We have to develop ourselves in that way. So just like we have to develop our skills in manual dexterity, We also need to develop the ability to become aware, patient, and wise, and compassionate as healers, right? We're truly healers. And it's assumed that healthcare professionals naturally have these abilities and pay attention in both clinical and learning situations. However, studies show that people are only briefly and predictably attentive. So out of habit, we get distracted and our attention moves to unrelated thoughts and feelings, right? Can we all relate to that? And we can tend to zone out and become mindless. And this can happen quite unintentionally and without conscious awareness. And when we do that, errors and failures in task performance can result, and ultimately our patients can get compromised. Now, today, we are constantly challenged by distractions, right? It's just the world we live in today. It's very, very hard to get away from the distractions that are constantly pulling us in a million different directions. And it takes deliberate practice and skill to navigate through these distractions, not get caught up with them. I like to call this the technology tornado. We're also faced with what I like to call as a digital dilemma with constant connection to social media and emails and texting. And these certainly have their place, right? We can't live without them, but there are limits, and we can only set those boundaries for ourselves. So maybe some of you have heard of Dr. Ed Hallowell, who is a psychiatrist and specialist in ADHD. And he feels that many Americans are suffering from what he has coined attention deficit trait. So it doesn't mean that you necessarily have to have a diagnosis of ADHD, but that many Americans have the tendencies to have this condition induced by our life, our modern life, in which we're becoming so busy attending to so many inputs and outputs that we become increasingly distracted, irritable, impulsive, restless, and over the long term, underachieving, right? So it's also very similar to burnout. And we as dentists are very susceptible to this. So back again to the ethics handbook for dentists, which describes the term professional, right? So the term professional used in this handbook refers to one who practices a learned profession, one who has special knowledge and skills to benefit the public regardless of personal gain. So special knowledge and skill is what I like to say are mind-body practices. They offer special knowledge and skills that will benefit us personally, but can also benefit us as professionals and benefit the patients as well. So we're always looking to upgrade our technology, right? We're always looking to upgrade our software, our operating systems. So to meet the demands of our increasingly complex world and to meet the demands of our profession, we need to upgrade our inner technology, right? We don't think about that, right? We're so brilliant, right? We're brilliant beings. And so mind-body practices not only can be a powerful tool for enhanced well-being and mental focus, but also for self-connection and connection to others and to experience life also on a more deeper level. So thinking about that, like how mind-body practices can upgrade our inner technology. So I thought I would take you into Tufts right now and give you a sneak peek of how we are teaching mind-body practices in a practical way to help our students upgrade their inner technology, to connect with themselves, to calm themselves, to improve their focus and perform better. So before I show you the context, before I show you the video, I'd like to context what you're about to see. I've been in this role. This is my 6th year in my role as the director of Mind Body Wellness. And if this is a role and everything I do, this has been a very creative approach to dental education. But a few years ago, the heads of operative dentistry called me up to their office and they said, Christina, we've had the highest failure rate in the operative competencies this year. And when we talked to the students that failed, each and every one of them said it was because they were so nervous. Their hand pieces were shaking. They couldn't compose themselves. And they said, now we've got to get you into operative dentistry. So 3 years ago, I came into operative dentistry and brought breathing technique into the preclinical setting. So here's what's going on with our students.
So I had this moment in the competency. I kind of pulled out the mylar strip and I realized there was this massive overhang kind of on the gingival level, and it had never happened before.
Dental school is really stressful between exams, competencies. I think everybody has these moments throughout the week where it just feels like the weight of the world's on your shoulders and you feel super stressed.
And so it wasn't a situation that I was really prepared to deal with. And I had a moment of, oh no, what am I going to do? And having that deep breath that gave me the seconds and the calm and the focus that I needed to really form a strategy to tackle something that I hadn't experienced before.
We were looking for something that would help them deal with the stress of the situation and be more relaxed so they'd have a better outcome with their examination. I remember coming into Dr. Kugel's office and I said, why don't we get Dr. Pastan to come and present to the class?
One of my focuses here at Tufts is teaching our students self-regulation, mind-body practices, not just to help them cope with the demands and the stress of dental school, but to teach them to be grounded and mindful practitioners.
I think back to the first competency where we did a deep breathing beforehand, but I remember feeling very anxious and sitting down, and I did the breathing and I felt calm and really in the zone.
Diaphragmatic breathing is a technique that utilizes the full capacity of the lungs and engages the entire respiratory system. And through that practice, the body relaxes, the mind focuses, and it's a very effective technique for reducing feelings of stress and overwhelm.
When I'm doing a competency, I try and practice breathing and focusing and regaining myself when I'm getting stressed or frustrated, because it is going to happen. And we know that. We are trained for that. And we are trained how to move through it and still give the best care that we possibly can.
And this seems to really relax our students and help them focus through the exam.
It seems that they're doing well on these practicals. They seem to be doing better than they have in the past. It seems to have worked.
What we hope is that this training will carry over into their clinical treatment of patients as well, and even into their professional careers.
At this point, I really can't imagine doing a competency without doing the breathing beforehand.
When the breathing exercise is over, I feel a profound shift from an environment of tension to an environment of professional tranquility.
Well, I think diaphragmatic breathing allows me to do that in any type of situation. I'm able to focus, think clearly, and get the results I wish to have.
It's our responsibility as professionals to be able to focus, to be grounded before we see our patients.
For me, diaphragmatic breathing has been that regravitating force for myself. There are techniques out there that you can utilize to mitigate your stress And I think it's something that has been really successful here, and I think it's something that can be really successful elsewhere.
The wellness program at Tufts is actually the reason that it was my #1 school when I was looking around. It indicates that it's a school that really cares about the stress level and well-being of its students. And I think that's something that's going to be applicable for the rest of our lives as dentists. You know, we're going to see new things all the time. You're going to need to give yourself that second and that calm and that focus to make a plan.
What this is doing is teaching our students to connect with themselves. And when we connect with ourselves, we are better able to connect with other people. And in the profession of dentistry, the deeper our connection with others, the better our patient outcomes, the better our dentistry. My name is Dr. Christina Pastan, and I am the Director of Mind Body Wellness at Tufts University School of Dental Medicine. I miss my school. I haven't been in there in a long time. So why do these techniques work? Breathing, meditation is part of yoga. So I'm going to talk a little bit about yoga for a moment. So I'm going to back up a bit. These practices were created over 5,000 years ago, and they were created as practices to help us navigate life. They're physical and mental practices to help us calm our body, but to navigate life. Yoga is not a standalone. So there are 8 limbs of yoga, and they consist of ethical practices, external virtues of character, internal virtues of character. I can't get into all of these right now, but because I'm running out of time. But it also includes posture, breathing, withdrawal of the senses, concentration, meditation, and then integrating that. And so why do these practices work? Well, the research shows that these practices provide us with both top-down and bottom-up tools that work together. And how do they work? Well, top-down tools impact the mind directly, and they have a trickle-down effect on the body and our behavior. So it improves our ability to manage our emotions and increase our self-compassion, right? We need those skills in dentistry. It also helps reduce the amount of mental and physical strain. Bottom-up tools impact the body directly. They impact our physiology, right? They get us into our parasympathetic rest and digest state. They improve the function of our vagus nerve. And so as dentists, we need the ability to be able to do this. What we do is demanding. You're already seeing that as dental students, and it doesn't get any easier. And so being able to start thinking about how to incorporate some simple ways to rest, relax the mind, relax the body, not just for your personal health and wellness, but also to be better dentists. So I asked the students on their first days of dental school and orientation when they're thinking, what is Dr. Pastan going to be teaching us? Like, what are we getting into with her with yoga and meditation in dental school? What's going to happen? And so I asked them, what word comes to mind when you hear the words yoga and meditation? And they're all doing their poll everywhere, and they're making a word cloud. And so this was last summer's word cloud. So these are the words that came to mind. Calm, control, balance, relax, clarity, focus. And so when I put the word cloud up on the screen, I said, think about these adjectives, these words, right? Calm, balanced, controlled, focused, right? These are all adjectives that I would want to use to describe the dentist working on me. And so when we're in this place of presence, these practices help us come more consciously aware, right? And when we become more consciously aware, we interact with the world differently, right? We're more graceful in our actions. We are better communicators, better listeners. We are more patient and kind to others. And we have the ability to pause and wait before reacting and deciding. So everything I just mentioned, I feel are essential qualities that we need to embody. So the professional process revolves around cultivating self-awareness, acceptance, wisdom, compassion, and self-care, right? These are all of the qualities we need, right, in our professional development. But then when we look at the human process, right, how we want to be just as human beings, regardless of what we do in our lives, right? We want the same, to cultivate these same qualities. So how do mind-body practices help us do this? Well, they help us by teaching us to be quiet. And when we're quiet, we can be with our thoughts and be more accepting of ourselves and others. We can develop more wisdom, right? The ability to see life as it really is and not how we want it to be. And when we can sit with ourselves and be kind and compassionate with whatever we're feeling, right? The compassion that we need to develop with others starts with ourselves. And when we can be non-judgmental and kind and accepting of ourselves, we can be that way with others. So when we come to these practices, to the yoga mat, we don't look in the mirror, we don't care, right? We accept what our body can and cannot do. We sit with ourselves and breathe and feel grateful, right? Then that just spills out into others. So I thought I would end with all of you with a little meditation 101 and guide you through an experience to relax the body and calm the mind. And so we're going to engage in a short meditation that's going to take us through these 5, what I like to call these 5 steps of mindfulness. And these are basically the 5 steps that I learned when I was at Kripalu. And this is how they teach us actually to guide experiences. And it's something to take a picture of your screen if you want, because I feel that just thinking about these helps us go through life in a calm and more graceful way. So first and foremost, we need to breathe and notice our breath, right? And then relax, like notice what you're holding, whether it's a clenched fist, tension in your shoulders, and let it go. And then feel, right? Feel what's happening in our body, right? What are the sensations, right? How do we become more tuned in and not be numb, right? To the brilliance of what's happening inside. And then to watch and allow the experience to happen with non-judgment and compassion. Just let it all happen. So I invite you all to get relaxed in your chairs. And hopefully you can hear some music coming through your computers. And just settle in. Keep the eyes open for a moment and just notice the space around you and just settle in. Feel your feet rooted into the floor. Feel your sits bones grounded in your chair. And press the crown of the head toward the sky. Feel the belly open. And if it's comfortable for you, close the eyes or bring a soft gaze down to the floor. Relax the shoulders down your back. And now that you're settled in, place one hand on the heart and one hand on the belly and connect with the physical body. The physical body is that outer layer of being that carries us around the earth. So just notice how you're feeling this morning. And wherever there may be some areas of tension in your body, invite in some softness. And now direct your awareness to the breath. And simply just notice the breath as it comes in and out of the body. Notice how when you inhale, the body expands, the chest rises. And when you exhale, there's a sense of letting go and the belly retracts and the chest lowers. And so keeping connected to the breath as an anchor, the hands can stay where they are or move back down to the lap. And with this sense of breath in the foreground, your whole being might be able to relax and soften. Feeling the muscles of the face, the lips, the tongue, the jaw, all relaxed. Feel the belly relaxed, the arms and legs relaxed. And as you breathe and relax, maybe shifting to what you might be feeling right now. What sensations in the body can you tune into? Maybe the sensation of tingling or vibration or pulsing. Tuning into that subtle energy flow. Maybe sensing the heart beating in the body. And at the same time as you're feeling all this, can you be a witness to your unfolding experience? The witness is your capacity to observe this experience with no judgment. You can't do this wrong. And in the midst of all that changes, feeling that sense of compassion and non-judgmental awareness. And now exploring that quality of allowing that inner experience of simply letting things be, letting this experience flow without trying to change anything, just being with it. So breathing, relaxing, feeling, watching, and allowing. And now bringing some waking movements to the fingers and the toes and deepening the breath. As I ring my chime, slowly open your eyes and take a moment to notice how you feel. Before I unshare my screen and open up for some Q&A, I wanted to share with you my email. I am able to be found on Instagram. I have an Instagram at Dr. Pastan's Peace of Mind, where I share videos of mindfulness and life anecdotes for my students and for all students, and a YouTube channel with my yoga classes and my meditations. So I invite you all to check those out, or if you have any questions, please feel free to email me.
Great. Thank you so much, Dr. Pastan. I love that. That's such a valuable skill to learn in dental school. So for questions, I'd like to remind everyone just to drop it in the chat or message Nikki or me, and we'll go for the next few minutes. I think we have about 8 minutes here. I have a question, actually, if we can get it started on. So is there a set amount of minutes per day you recommend to meditate or incorporate breathing into your practice?
I would say 3 minutes, and thinking about, you know, how we brush our teeth, right, for about 2 minutes. So thinking about for people that want to get started, 3 minutes is a good way to get started. If we want to think about the research shows that 10 minutes of mindfulness meditation practice is where the physiologic long-term results happen. So I like to say start with 3, and if you work up to 10 in 8 weeks, you will really notice the physiologic changes in the body.
Thank you. So we have a question in the, actually it's been directly messaged to me. Do you have a morning routine that you practice and you'd like to share with us?
Yes, my morning routine is when I wake up in the morning and Alexa wakes me up, I lie in bed for about 2 minutes and just listen to what's going on in the world. I take in silence. Listen to see if the birds are chirping outside, what I can hear, the dogs barking in the neighborhood. And then I get up and walk my dog, do my thing. And then before I get in the shower is usually when I do my meditation practice. And I think of my meditation practice as just part of my morning hygiene routine. It's just, I can't imagine not brushing my teeth or flossing my teeth. And so for me, I say, you know, meditation's my mental flossing, if you will.
All right, we have another question. How would you suggest dental students integrate these practices given the uncertainty of current COVID situation where we are spending more time on screens and away from our peers?
I think it's really important to have a time in the day where you go off of your computer and your phone. And for me, after 9 o'clock, it is a pretty much a no screen time. You know, my kids have been around. I have kids that have just graduated. One just graduated college. So I always tended to want to have my phone around in case they wanted to get to me, but they're here now. So they're here. So after 9 o'clock, it's kind of a nice time to make it a sacred time for yourself. And if it's whatever time it is, that half hour before you go to bed, a lot of my students, I come into my office and ask me this question. I say, you know, light a candle, dim the lights, make a cup of tea, and make that last hour of the day a time to read a magazine, read a book, knit, listen to music. So it's important to prioritize your self-care, especially during this time.
All right, I guess we have time for one more question. This might be a good send off for the rest of the day. Taylor asks, do you have any podcasts or YouTube videos or app recommendations for mindfulness and guided meditation?
Yes, I love Insight Timer. That is a free app. That is actually the meditation app that I use. because you have an array of free meditation offerings that are offered by some of the best meditation teachers in the world. You can also set your own timer, and it gives you kind of an accountability scale of how you're doing. I think Headspace is also excellent. I know they have student discounts for students that want to engage in that. In regard to podcasts, I guess I would send you truly to the Kripalu website, Kripalu, the Kripalu website, where I was trained. Some of the best teachers in the world, and they have a lot of incredible offerings for mindfulness, yoga, breathing, just healthy ways to live.
Great, thank you so much.
You're welcome. Thank you again, District 2, for inviting me.